All right. Welcome to Everything Everywhere Spa Dentistry All at Once. In this captivating presentation, we bring you the incredible story of Dr. Joshua Vang, a renowned dentist and med spa owner in Minnesota, whose journey from an aspiring student to a successful professional is nothing short of inspiring. Dr. Joshua Vang was born and raised in the Twin Cities. He earned his Bachelor's of Science in Chemistry with a concentration in biochemistry at Carleton College. He went on to earn his Doctor of Dental Surgery degree in 2006 from the University of Minnesota School of Dentistry. Dr. Vang began private practice soon after graduating in 2008 at Cherokee Dental, where he's been able to provide treatment in all aspects of dentistry, from surgical to cosmetic treatments. Tonight's webinar is brought to you by Empire Medical Training and our industry partner, Sinclair. Sinclair is an international company operating in the fast-growth global aesthetics market. Sinclair has built a strong portfolio of significant growth, targeting unmet clinical needs for effective, high-quality, longer duration, natural-looking, and minimally invasive treatments. Sinclair is planning entry to multiple new geographic markets and line extension launches over the next few years. The group has established sales and marketing presence in North America, the EU markets, Brazil, Mexico, Colombia, the United Arab Emirates, Hong Kong, and South Korea, and a network of international distributors. Before we begin, I want to start off by sharing some valuable information about Empire Medical Training. Empire Medical Training has been providing 25 years of training and has been in business since 1998 with over 175,000 graduates and counting. Our courses are taught by expert level physicians, and we offer Category 1 CME credit hours. We also have over 700 seminars annually across 50 states. With over 45 courses to choose from in aesthetics, anti-aging, pain management, medicine, and surgery. We really hope that your time here with us at Empire Medical Training is an unforgettable experience, and that the knowledge and skill sets you gain will not only maximize your business potential, but will also change the lives of the patients who come through your office doors. Our learning methods are by hands-on training with live workshops or online training through Empire Livestream, Empire in Motion, Empire On Demand, or free webinars like this one. At Empire, we do our best to introduce new courses each year. So this year alone, we begin by adding some classes like exosomes, the perfect butt, and more. During tonight's presentation, you will have the ability to ask questions by using the Zoom Q&A feature at the bottom of your screen. Please be sure to put all of your questions into the Q&A, not the chat, as they do tend to get lost in the chat. And the last 15 minutes of our presentation tonight, we will have a live Q&A. We do also provide a chat box for any additional interaction or support. With that, I'm going to turn it over to Dr. Joshua Vang. Dr. Vang, thank you so much for being with us.
Hi, thanks for the introduction, Fallon. I appreciate it. I feel like I was on a live sports draft, so I feel like I just got drafted by the cosmetic world. So, but thank you very much for the wonderful introduction. Let me share my screen and get going here. There we go. Let's get you going here. There we go. I think we're good. Again, want to say thank you, everybody here, for all of you guys who have made it tonight and taking time out of your evening to hang out with Empire Medical Training, as well as myself, to run through just some fun stuff tonight and just some very informational things here. As my presentation states, everything, everywhere, spa dentistry, all at once. You know, it's one of those things where it doesn't even just pertain to dentists. It pertains to a lot of health professionals out there and who are looking at the cosmetic world and looking to branch off and expand, whether it's their own business or their own knowledge. There's so much out there to learn. So, but this presentation really does kind of just goes through my experience and how I kind of thought about going into that route and how I got into it and where I've gone and where I'm at now. So hopefully you guys can bear with me here as I go through this, and hopefully it's an enjoyable presentation. So, but again, want to give a little special thanks to Empire Medical Training, as well as Sinclair Global and Vera for inviting me and allowing me to share my story, and as well as give some pearls that I can, and hopefully give the knowledge for some of you who are aspiring or even looking to go in this route. So again, thank you guys for having me tonight. And a little bit about me, as Fallon kind of mentioned. I graduated in 2006, and I can't believe I've been a dentist for almost 2 decades now. So I taught right when out of graduation. I taught prosthodontics for about 5 years. Loved teaching, which is why I loved getting back into teaching here. Love doing some talks to really help folks out there who really want to learn. And again, I thank Sinclair for giving me that opportunity. But again, been practicing for almost 2 decades, and I started in the med spa realm, kind of going into Botox and fillers back in 2019, literally right before the pandemic. And so it was one of those things where it's like, oh, you learn the skill and you don't get the opportunity to use it. So it was a little disappointing. So, but as I got to learn more and more, it was something that really interested and piqued my interest into getting into the cosmetic world. I did start out as TMD and learning to try to treat that with migraine headaches. So that's kind of where it opened the door and almost floodgates to understanding that there is a completely different world out there outside of just dentistry. And that's coming from a dentist, right? So that's coming from a dentist who, cosmetic, whether you're doing cosmetics or restorative, full mouth reconstructions, if you're an orthodontist, even ortho, you're doing smile designs and things like that. So definitely there's a lot more to it than just dentistry out there for any health practitioner out there who wants to get into it. A little bit more about me, about my office. Took over a existing office back in 2008. It was a family-owned dental office, so I took that. This is exactly how it looked at right when I took over. Cherokee Dental was the original name. It was Cherokee Family Dental. In 2020, that was when I transitioned during the COVID time. Just transitioned into a partial med spa as I started to understand it and do more and more cosmetic treatments. It transitioned in 2021 into a full med spa where we were offering, full body contouring and skin tightening and things like that. So this was my sign back then, Cherokee Family Dentistry. If you guys can know the colors earlier before, I'll show you before. Orange and green, old 7-Eleven. I kind of made a joke a couple of years ago when I did a presentation like this. Old 7-Eleven that they converted into a dental office. I finally decided to paint the building a nice contemporary gray, and we actually changed it to Cherokee Dental with a new logo, Cherokee Dental and Med Spa Clinic, which if anybody is actually looking to get into the cosmetic world or looking to just change their office dynamic or even rebrand their office, this is a great opportunity for you to have that chance to do it. And so what we have done and transitioned from the Cherokee Dental, and Med Spa Clinic is we've been able to expand our office, get into a brand new building where our 7-Eleven building was 2,400 square feet, getting into a larger building, which was about 6,000 now square feet. So we have two levels to really work with. And it also allowed us to rebrand, and this allowed us to, do something more than just what dentistry allowed us to do. And so now this is our new sign here. We've got a brand new dental sign. This is on the upper level, and we've got a brand new front logo for a monument. And this is our med spa sign, and this is our med spa lobby. So this is what Sinclair has allowed us to do, partnering with them and utilizing their services and their equipment and units has allowed us to really branch off and really, kind of move in a direction where it's fun and exciting and it's new and it's fresh and things like that allow your office and your business to grow. So as dentists, we do sometimes hit a plateau. And so if you're looking to really branch off into something further, this is a great opportunity for anybody out there, whether again, dentistry or health professional, whoever's out there is looking to branch, this is a great opportunity to do it. I do get into the pun of who are we as dentists. This is kind of low play on words. As dentists, we wear many, many hats. There's radiology. We read radiographs all day long. We diagnose and then we treat. We're surgeons. We're always cutting hard tissue and soft tissue. We're pediatric dentists. As if you are, seeing and treating pediatric children, you're technically a pediatric dentist by trade. This is my joke here. You're a neurosurgeon if you're doing endo, right? Because you're amputating the nerve tissue out of teeth. So it's kind of a funny thing. But yeah, if you do endo, we wear a lot of different hats. I don't really do veterinarian work, but there are periodontists out there who are treating and helping veterinarians do scaling root planning for their pets. So that's another thing there too. And the last thing we are We are all injectors. As dentists, we train every single day and we are injecting with anesthetic all the time. So that is one of our fortes. So as a dentist, you're doing it every day. Why not get into something that allows you to do cosmetics, which got me into Botox and fillers, and now we're doing other things. The last thing that we all are as dentists are cosmetic dentists. We're doing smile designs, we're whitening teeth, and we're doing ortho, we're repositioning teeth, and all of that stuff all plays into cosmetics. And so as we go along in the cosmetic world, I kind of focus on us as a dentist, right? What are we always focused on? Smile symmetry. We're always focused on facial aesthetics, right? The lip lines, golden proportion. We're looking at gummy smiles, lip volume, size, length. I mean, every day we're always looking at something that we're restoring. We're looking to make sure it is symmetrical, it is dimensionally proper, because when you restore somebody's front tooth, that's the first thing that they're going to look is to see, does it match? Does it look the same? Does the shape and size look equal and proportional to the other ones? So we're always looking at that. If you take it a step further in the cosmetic world, it's a very similar, if not the same type of treatments that we're going to be looking for and discussing with clients that come through the door. We're always looking at whether it's skin, body contour. We're looking at the proportions, volume, smoothness of the skin, the texture, the fine lines, wrinkles. We're always looking at that, those definitions and those traits, and just saying, okay, well, how can we help a client that comes through the door? At the end of the day, we're looking for the total package. We're looking for everything that's going to make it, to our knowledge, to make it, to their benefit, to give them what they're looking for, and to make it as I say, look as perfect as possible. Will it ever be perfect? That's really truly, as I say, in the eye of the beholder. So when they come to you, it's going to be our job to really and truly help those clients that come through and look for what they're missing. My little quote here, as a dentist, teeth are our internal support structures, just as our facial features as collagen is our support for our skin. So think of teeth, it gives our definition for our cheeks, our lips, our smile, whereas the skin, that collagen is what really truly helps us define our skin and our features and substructures that we have. So think of it like that, and you're just taking it beyond that box from teeth to skin and aesthetics outside of the mouth. Again, going back to this, what I touched base a little bit earlier, is in the cosmetic world, the beauty is always evolving. It is ever evolving. Back in the 80s and 70s and 80s, up until now, the definition of beauty has changed so much, and what people are looking for has changed so much. I think and me doing this webinar today and just kind of seeing myself in the little box there, ever since we've had COVID, everyone has been looking at themselves almost pretty much in a mirror. And so this is what has caused the world to explode. And this is what has caused cosmetics to explode, is because we're actually seeing things that we never really noticed. And now that we're, having a lot of attention to it, it is something that is actually making us want to maybe, and healthier, get ourselves a healthier diet, or get us treatment that's going to make our skin look more healthy or feel healthy. So all of that kind of plays into it. So at the end of the day, again, beauty is in the eye of the beholder. And when a client comes through, it is our job to really help them focus and find out what they're missing, because they're going to come to us and find out, they're going to ask, hey, what am I like this, and that, but I feel like I'm missing something. The day that you can help that client find out what they're missing, they're going to be a patient with you, indefinitely, and they're going to love you for it. I got a couple little cartoons here. This one here is, I don't think my skin is saggy. I think of it as relaxed fit. As in a spa, you bear in mind there are 3 laws that in the gym that we can't ignore, and that one is health, second is safety, and 2 is gravity. So those are the 3 things we just unfortunately cannot fight outside of doing what we can to obviously stay healthy. And the last thing, this is one of my favorites. When you lay down, you're looking at yourself, you're like, oh my gosh, I look great. And then you turn to your side and everything just kind of changes in different directions due to gravity. So, this is what has allowed, Sinclair has allowed me to really, get into this realm and these treatments to really help clients as well as myself, get into a healthier state of mind and feel healthier and look healthier. This next part here is a little fun little excerpt from a movie here. Hopefully you guys can enjoy this part.
Mr. President, after I destroy Washington, D.C., I will destroy another major city every hour on the hour. That is, unless, of course, you pay me $100 billion.
Dr. Evil, this is 1969. That amount of money doesn't even exist.
Fast forward from 1969, we are in 2024. Just the beauty industry itself generates over $500 billion revenue worldwide, let alone the skincare. If you Google it, the skincare market is projected to produce a revenue based over $180 million worldwide. So just think of that number back in 1969, moving fast forwarding up to today, present day today, $500 billion. So think of how many zeros that is in 1 billion is 11 zeros, right? So if you really took that and you broke it down, and this is one of my favorite sides, is take that $100 billion and you break it down. 1% of that $100 billion is you're at $1 billion. Break it down a little further, you take it down 0.1%, you're at $100 million. Let's keep going further. You break it down to 1/100%, it gives you 10 million. Break it down one more time, 1/1000th, you're at a cool 1 million. Then let's do one final 1/10,000%. That is $100,000. Now think of it, that's $100 billion. You take that times 5, right? Because that's what the beauty industry generates. So think of how much revenue and that you can bring if you just had a small snippet of that. And it doesn't have to be the 1% or 1/10,000th, but just the revenue generation that you get from the beauty industry itself is just going to be going up and up and up. So it's not, I don't think we ever will see it spiral downwards, because I just think that the cosmetic industry is just an industry that is going to keep booming for the long haul. Here's another snippet from another movie. I'm sure a lot of you guys probably know the movie.
Under Dr. Price.
Okay, let me look that up for you.
Dr. Price? Stu, you're a dentist. Hey, don't try and get fancy.
It's not fancy if it's true.
He's a dentist. Don't get too excited.
That's one of my favorite movies, The Hangover. So definitely let's get excited, right? We're all dentists. And even if you're not a dentist, again, you definitely have an opportunity and you have a reason to get excited, because in the med spa world and cosmetics, there's a lot of things that will allow you to be able to do things, a lot of tangents that you can go. You just decide what you want to do. But as dentists, we should get excited. It is one of those things where we have so much knowledge in our hands and we have so much opportunity for us to grow and to do more. We are dentists, we are doctors, and I have had some doctors and dentists come up to me for my personal thing is, overall, we know the head and neck better than anyone out there outside of a plastic surgeon. And I've had some dentists come up to me after my presentation and tell me that they think that dentists, know more about the head and neck than a plastic surgeon. For me, I think it's, part and partial, right? We all work together in a healthcare field. End of the day, we're going to lean on each other to help each other out with whatever cases or whatever concerns or issues we may have. And it's going to be good for us to even have those communication opportunities and bridges and have those relationships to help each other if there is ever a need for it. So, at the end of the day, a plastic surgeon, a nurse practitioner, and a registered nurse, an MD, a DO, esthetician, we're all in this together. So we are literally one big happy family. So I wouldn't say that any one profession knows more than each other, but I will say that, as the world changes, we all have this opportunity to get into this overlapping multiverse of professions, right? Where it comes down to who is going to be able to help each client in multitude of opportunities. Now, as a dentist, I personally think we have one of the most unique opportunities in the world. Dentists, I think, will be the single most versatile health professional in the world, because dentists are the only profession out there that can treat the mouth, treat restorative in the mouth, create complete smile design and makeovers, and treat, everything from edentulosum to full mouth reconstruction. And now we have the opportunity to treat facial aesthetics as well as full body aesthetics. It gives us that everlasting oomph of, knowledge that we can give to our clients and expand and offer them even more than what we're able to do as dentists. So for me, I think, again, as a dentist, if you're a dentist out there listening to this presentation, I think that you have one of the most unique opportunities of a lifetime to kind of get into this world, this med spa realm in the cosmetic world, because it's just starting to boom. So definitely, hopefully you guys get the opportunity to do it and jump into it. Now, why did I get into the cosmetic market? My question was, why not, right? We as dentists, we see patients twice a year. Patients love to come to see you. They trust you. They come twice a year to see you for restorative or for hygiene and visits. How often do they actually go to their regular patients go to see their primary doctor? Unfortunately, they don't go as often as they should. But as crazy as it is, we see our clients twice a year, and if not more, through restorative. We have patients, we have traffic flow, so why not get into the cosmetic market? Because you already have clients that you can offer the treatments to. So it's great. And then the last thing is, dentists, we are one of the only cool professions out there that can actually own your business and have cash flow and have, an opportunity to grow. So when you invest in some cosmetic units, whether it's units or Botox or fillers or whatever you decide to do, you have that opportunity to invest in it, because you do have a growing practice that is growing with you, and that is generating revenue that is going to help you offset any of the things that you're wanting to bring to your clinic. So the question I always get is, what are we always looking for in the cosmetic world when we start to go and venture into it? Obviously, training, courses, products, reputable and proven results, customer service. Obviously everyone is looking at money. How much does something cost? Will we get our best dollar value or return on investment, bang for your buck? So we're always looking at. So this is kind of where I started, and so this is if you need any help with it or advice, let me know. I'm more than happy to chat with anybody there. But this is where I started out, and back in 2019, back in August, before that pandemic hit. I started courses with Dentist Boss Seminars. They're a group that really does hone in with dentists. They cater to dentists, so they have multiple courses that you can take. I took their D1, D2, and D4 courses. I got into the cosmetic world because I wanted to treat TMD, joint discomfort, and migraines. So I got into Botox and fillers. So that's where I kind of started off. Moving along, this is where things really started to change the dynamic of the practice I was at. Back in 19, I purchased a Photonal light walker, and I was able to do just a minimal, cosmetics, where we were doing facials and smooth lays. And we were, and that's when I got introduced to Viora back in 19 at the IFA, which is the International Academy of Facial Aesthetics. And they're a group that does like to bring a lot of different minds together. So it's a great opportunity for you to get to learn things and to see things out there. That's where it led me to back in 2021. At that time, the company was Viora, and now they've merged with Sinclair. And this webinar gives me the opportunity to kind of talk about the units that I got. And this was my thinking as we got into cosmetics. Was I purchased the V10. So Viora has a plethora of units at your disposal, if you are, depending on what you want to do with your choice into getting into cosmetics. I decided to go with the V10. They have a platform series of what they call the V series, and it's they're units that have a multitude of treatment modalities on one single unit, one single platform, which is what, as a dentist, that was great, because I was always looking for, hey, I want something that's going to give me so many opportunities that I can treat multiple things at once. This V10 is their base model, and it allowed me to do skin tightening, adipose reduction for body contouring, It gave me what's called the VFR handpiece for ablation and scar tissue resurfacing, acne scar tissue resurfacing. I mean, stretch marks. I mean, it was amazing. And then now we've added on the VVR, which is on a different unit, but I'll get to that too. But it allowed me to do multiple different, opportunities and treatments with just one unit, which was awesome. So, which with that, I got the Dermafuse, which is an ionizing microinfusion of serum that you can use for skin treatments. They have ones that treats hydration or dry skin. It has one that does collagen boosting, another serum that does skin brightening. There's a plethora of things that you can do, and not only that, with these two units, I was able to stack treatments, meaning that I was able to combine what I got with the Dermafuse, which is the smaller unit, with the V10, which is that bigger unit, and stack the treatments together and really maximize the treatments that we got, the results that we got. Then we got the InnoPen, which is a microneedling pen. So that's where we started. So back in 2021, we started out kind of small. It was fun. It was more of a side gig to really just have fun and offer some patients who wanted to get into some cosmetics. Moving along in 2022, can't believe it's already 2 years ago. I invested in another. This is when they merged now to Sinclair. I'm invested in with another series, which was the V series. Again, this before I got the V10, which is the smaller. This, like I always call it, the little brother, whereas the V30 is the big brother. This unit has even more treatment modalities to it. It not only does the skin tightening, the VFR, the ablation. Not only does body contouring, but it also includes the IPL, which is a intense pulse light, as well as the ND-YAG, which you can treat, anything from like cherry angiomas and pigmentations and things like that. So that unit was even more, had an even more multitude of treatments in one single platform, which was fantastic. Then I got into laser hair removal. So we purchased and invested in the Elysian Pro, which is strictly a laser hair removal unit. And then we got the Pristine that we got with that purchase was that, and that's a microdermabrasion. So if any of you guys don't know what microdermabrasion is, this is one of the best units on the market where you're clearing out pores, clearing out dead skin. This is one of the units that I used for complementary treatments for patients because you could do it for 5 minutes. It's a 5-minute treatment. As fast as that, you can treat lymphatics and things like that. And it was nice, and patients loved it. They got done with that treatment. They could feel their skin super soft and smooth because you're clearing out all those layers of dead skin. So I invested in these things the year later, and I kind of started to build my armamentarium of units and being able to offer different treatments. I went a step further in 2023 again, which is just a year ago, and then invested in a unit called the Energet and the Premay, and I ended up purchasing a second Dermafuse. Now the Energet and the Premay, if any dentists actually want to get into cosmetics, these are some of the premier units that I've on the market right now. The Premay is basically a unit does like think of a hydrofacial and an oxygeneo and a radio frequency treatment. That this Premay unit does all of that with one unit. So it's got a 5-level treatment for your facial. It is probably one of the coolest machines I've ever invested in. Patients have loved their treatments when they've gotten their facials. So if anyone is out there looking to even start something that's simple as that, this is probably one of your go-to startups, and also maybe even getting a V10 and comboing those packages, because those two you can treat the body and this one you can treat the face. The next thing, which has been one of the most revolutionary units that I've enjoyed having at my office, and I'm just barely even touching the surface of what this machine can do, is the Energet. That's the Perfection Energet. That is the only needleless injection machine in the world that allows you to take a solution and inject it in a small 200 micron opening and inject it and disperse it underneath the skin. It is the coolest thing. It is one of the funnest things to do, where we're doing PRF treatments, and you'll see one of my slides and one of my treatments. We took a video of it live. And so we're treating it with PRF for patients for hair rejuvenation. We're breaking down keloid scars. We're taking derma fillers, diluting it, and doing kinetic facelifts So, and they're all needleless injection treatments, which is awesome. And treatment wise, discomfort wise, is pretty darn minimal. It's pretty awesome. So again, got a second dermafuse unit there. So it was just great to have those extra things there. And the last thing we just purchased and invested in May of 2000, just a couple months ago, was the Sunlight Pro. This has been one of the coolest things to have at the office here and at the med spa is the Sunlight Pro. It's going to tell you sun damage, areas of erythema, inflammation. It's going to tell you pores, and it's crazy because you can actually show clients in a 3D view and they kind of get grossed out, but it's eye-opening because it tells them how much the sun has been causing issues to your skin and how much damage it is. And you don't realize how important sunscreen is. And so this is one of the coolest things we've added as a nice final, cherry on the top to allow clients to see what they're actually having the sun do to their skin damage wise. This is a little insert of the pre-made just because I loved the machine. Just as again, just kind of talking about the things that you can do with this unit. It's a facial, it's a hydrodermabrasion treatment. That's kind of like your equivalent to like a hydrofacial. Then it does a bunch of other things again, like the CO2 microdermabrasion, where you're bringing oxygen back to the skin. The micro T is a muscle toning to really help those muscles get stronger, give you more definition. And then you have a collagen and hydration where you're doing collagen boosting and then a hydration treatment to cleanse it. I always call this is the everything you need, everything you want all at once, because it has everything for you at your fingertips for an ultimate facial. The Interjet, I just talked about this a little bit because I love this machine. The more I use it, the more we get to use it, it just becomes more fun because of the clinical results that we're getting. So think of keloid scars or hypertrophic scars. And the next thing I'm doing right now is we're contacting patients who have cleft palate hypertrophic scarring on their face and their lip. This machine I've been working with another doctor, Dr. Mark, and we're going to be doing hypertrophic scar tissue breakdown on cleft palate scar tissue. So this machine is a step above anything else in the world, I think, that's going to allow clients that have patients who have hypertrophic scar tissue on their lip to help dissolve it. It makes the whole world of a difference to help them get that color in their lip and their skin back and not have that scar tissue there. So this is something that I think is going to evolve the way we treat aesthetics in the safest and the most predictable way. It is such a cool machine to have. I got a little video here on the Interjet, so just something to show you cartoonish wise, just to kind of let you see kind of what it does. Now, this machine has been kind of, in the world already and just finally got brought over to the States. Fortunately, I feel like the States sometimes are a little bit behind on times, but that's okay. We're obviously, as the world evolves, technology evolves. So we're always going to be, learning about the newest technology, whether it's slow or fast, and sometimes it's nice to have it come back a little bit slower so that we know that it's efficacious, right? And we know that the results are proven results. But there you go. You can kind of see that blast go in there and disperse the solution that you would like to treat the skin with. And just kind of running through there, this is what it does: the kinetic facelift, scar tissue remodeling, and it does dermal thickening. So that's where you get the, you can help treat smoker lines, you can help thicken the skin where you've lost volume. A lot of cool things that you can do with this machine. To finish off the presentation, I did some cases, and these are my own cases. And so obviously as a dentist, I always like to treat and see if the treatments that I'm performing and I'm delivering for clients, are they truly working? And are they really helping the clients the way that I'm wanting them to be helped? This is a picture of the V10, so which is that first small unit, like the little brother unit that I had invested in back in 2021. This is a treatment for my mom. This is my mom's eyes. She had her left eye eyelid, which was drooping over her eye, kind of blocked her vision a little bit, and she did not want to go to surgery. If you know Asian people, they hate going to the dentist and the doctor, but she did not want to go and get surgery on her eye. So I was like, goodness, we've got this treatment machine and this unit that can do skin tightening. Let's give it a go and let's give it a try. We did 6 full sessions of skin tightening on her eye, around her eye. You can actually see how her eye has evolved and changed. It pulled up that eyelid. No surgery, non-surgical treatment, no downtime, easiest treatment we could have ever done for anybody. Her eyelid looks fantastic and it's pulled up and she has no obstructed view now. And not only that, but you can look at the wrinkles and all the fine lines. Those have softened a little bit around the eyes, around the eyelid. So it's just a remarkable treatment where my mom is just thankful that she didn't have to go and be put under to get that that extra skin removed. Here's another one. This was another one of our treatments where we use the VFR, which is their ablative, handpiece. And this again was on the V10, which is the little brother. This treatment was to do multiple things. It was one, to help remove pigmentation. And you can see on the before and the after, on the lighter skin is the after, but you can see her pigmentation on that darker picture. You can see that pigmentation actually almost disappear. But then you can also look at the texture of her skin. That skin looks so much smoother, so much softer. You can look at the fine lines and the deep folds that she has got. They have softened. She looks literally, 10 years younger just by having the skin have collagen growth, rejuvenation, and hydration. I mean, it is one of the coolest hand pieces that we have out there. So this did pigmentation and skin tightening all together, which was great. This next one, we had a client that came in. She wanted a more defined neckline, jawline, because she just had more adipose tissue. And this is another one of the coolest protocols that you have, what's called the relift protocol, where we're doing treating the lower face and the neck. If you go from left to right, you can see how much her jawline defined after the treatment. And she actually pulled that skin tighten the lower neck. It's skin tightened and it pulled that skin back. It looked phenomenal and she still looks great now. And she is just on regular maintenance now. So this is what's cool about a lot of these units, is that you can do these treatments and then do maintenance and it stays with you as long as they're maintaining a healthy diet and they're staying within their means on maintenance to upkeep the treatment that they've already been through. This is one of my favorite treatments. This was a skin tightening treatment. From left to right, look at her folds, look at her lip. Those folds from left to right look beautiful. She looks 10 to 15 years younger now, just by treating it. Skin tightening, no downtime. This is the same, very similar treatment that my mom got around the eyes, but this was for the lower face. Now look at her lower neck from left to right. Look at the skin and all of the crepiness and all the folds and the deep lines that you see. Those lines softened up. She looks fantastic. So these are true results that I'm getting from my clients, which has been probably the best thing that I could have, because it's true treatments that I'm showing our new clients that we're doing at our office. This was our body contouring. So when we first got the unit, as a dentist, I thought, most people would do head and neck because that's usually what I thought they would want to come in for. Probably the first 5 to 10 patients and clients that came through was doing body contouring. It was wild, flanks, stomachs, I mean, you name it, inner thighs, arms. It was crazy that the first, patients who signed up were doing abdomen and flanks. This was a treatment where we did for a female, 55-year-old female, start to finish, 12 sessions. She lost about 3 to 4 inches off her waist. It was amazing. So just seeing that, and seeing the before and afters was just astonishing. So, and this was, again, non-surgical. She stayed on the same diet, stayed healthy, and this was the beautiful results we got. Pretty cool. Now here's that one other case that I mentioned to you guys, where we're doing the PRF interjet treatment. Now this is one of those things where I was telling you guys, a needleless injection unit. It is the coolest thing that I think could have ever evolved on the market. And if anyone who has ever gone through PRF injections in the scalp for hair rejuvenation or hair regrowth or hair regrowth, it is painful to get a needle injection into your scalp. So this is what we did. It was a 15-minute treatment time, because obviously when you're spinning, you want to make sure that PRF doesn't coagulate, and you want to make sure you have enough time to treat the client. So we took the PRF, we had 8 mLs in us, and we transferred it into a syringe. We spun it, and that was 10 minutes, and the treatment time was 15. So here's a little video of how it worked. You'll kind of see it here, and you'll see those little papules. Those are the needleless injection spots that when that machine and that unit injects the PRF into the skin, that's that 200 micron opening, and you can barely see them. It's remarkable. And so, and you're seeing these little papules that pop up. They literally look like mosquito bites. They do disappear pretty darn quick. So you can see that pressure where that PRF is injected into the head, and this is the final treatment. And so that start to finish, 25 minutes. So it was a wonderful treatment. She did have a minor headache, but that's to be expected because you're putting a lot of pressure on the head and the scalp. Pain wise, it was like a mini rubber band snap, and she tolerated it so well, didn't flinch, and we just went to town, and she did fantastic. As crazy as it is, I just saw her recently, and even though her photos don't look the greatest in the sense of she has gray hair, so you still see her scalp, but you can see the thickness, and I will get some photos down the line. But her hair now, this has been about three months now, her hair is thicker. It is unbelievable, and you can see baby hairs grow. And not only that, just a testament of what's happening to her. She went to her stylist just 6 weeks ago, and her stylist had to call her colleague over to just look at her head because her stylist could see the thickness in her hair growth and the hair regrowth. And this has been a patient who was a cancer patient and had lost her hair back in her 20s. So this is amazing treatment. Is everyone going to be able to respond to this? Who knows? If the hair follicles are live, I think this treatment will work for them. If it's going to be there for them to be treated, that hair will regrow. But this was one that was a shot in the dark because she was a surviving cancer patient, and I was like, let's give it a try, because if we can get some hair regrowth, how cool would that be? Right now, we're starting to see it. It's amazing. I go further on here to talk about brands and companies, and I'm sure everyone who's on here understands and knows these brands by just looking at them. So, you've got your companies, you've got your McDonald's, your FedEx, Starbucks, 3M, Apple, everyone knows those. And so this is one of my favorite brands. So hopefully you guys get to just sit down and enjoy this video here, because it will bring back memories.
I don't wanna grow up fun, Toys R Us kid. They got a million toys at Toys R Us that I can play with. I don't wanna grow up, I'm a Toys R Us kid. They got the best for so much less, you really flip your lid. From bikes to trains to video games, it's the biggest toy store there is. Gee whiz! I don't wanna grow up, 'cause baby if I did, I couldn't be a Toys R Us kid. More games, more toys, oh boy, I wanna be a Toys R Us kid.
So you just have to, if you were in the era that I was in, Toys R Us was the mecca of every toy in the world that you would want to be at. You walk in, you're like, you just want to smell the ambience of the toys, right? And just brings back memories just to see it. So for me, why did I choose Sinclair Global? Why? Because to me, they are the Toys R Us of future, for the future of aesthetics. You cannot find a company, and I will say this many times, that has everything literally at your fingertips. The treatment units that they offer, that offer a multitude of treatments on a single platform, it's almost impossible to find a company that offers those units anywhere else. I don't know any company that offers laser treatments, IPL, full body contouring, skin tightening, ablation treatments, all in one unit. It is one of the coolest things to be able to see with anything that we will purchase, whether it's dental or cosmetics. It's pretty amazing to have that at your fingertips. Not only that, but Sinclair, as you can see in my slides, they've got proven results. It's treatments that work and treatments that I stand by with when I present them to my patients, and I stand by Sinclair because they have, the machines that deliver, 100% outstanding results. Not only that, they are ever evolving in technology, in the world of technology today. And on top of that, their support is second to none. I mean, I say this very, very proudly, that they are in a very rare air of customer service. You cannot find a better company out there that not only takes care of you, not only responds quickly and promptly to you, but has the best customer service when it comes to helping you clinically and professionally and technically. So it's a full package. And as a dentist, we know companies out there, when we buy a machine, sometimes you're on hold for 30 minutes just to talk to somebody. So at the end of the day, you know, in spa dentistry, I always say, or even in the med spa world, you can go big, you can go small. As a dentist, you have that option because you have an office that is generating revenue for you. So you have that opportunity to go slow or go fast. You know, for me, you know, it was just crazy. You know, everything went very quickly, but I invested in those, and the reason is because I wanted to offer as many options as I could to the clients that we treat. You know, so this is kind of a cool photo, a collage, and you know, a look of what I've got at my office. You know, we've got, you know, the V10, which is on the far left. You got the V30, which is the bigger brother. You've got the laser hair removal and Listing Pro. Now I know they just came out with the new Prime Lace, which is their new laser hair removal unit. So I'm excited to see it. So then you've got the Interjet, you know, the Dermafuse, the Pristine, the Prime, which is that beautiful machine, and the Sunlight Pro. So that's what I've got at my fingertips right now to offer clients. It gives them almost a full comprehensive package of anything they want to be treated with. Overall, in the outcome from a dental, a medical, and even a cosmetic perspective, us as dentists and even med spa owners, we're going to help our clients get healthier, be more health conscious, and lastly, look and feel healthier. All of these are, as I always say, are the end results of the numerous procedures that you can provide your clients. It's not one of those things where you come in, you restore a tooth, and you go home. This is something that clients are going to be with you for the long haul because they see the value that you're giving them to not only, again, improve their health, but improve the way they feel. It is huge right now, and the world has changed so much. And lastly, Sinclair Global, they have all the resources you need for anything you want to do, literally at your fingertips. And I know right now they're in the midst of learning and doing and are in research and developing so many new things in the cosmetic world today. And again, they are in the forefront of cosmetics when it comes to treating efficaciously and doing it well and doing it the right way. You know, things to think about as you kind of get into it. Just some pros to do is one thing that you want to think about as you get into the med spa world or even cosmetics is, what does your state allow you to do? Do you need a medical director? In the state of Minnesota, where I'm from, you know, a dentist can be their own medical director, which is fantastic. Now, if you are in a state as a dentist and they're not letting you do that, well, I'll tell you, Sinclair's got an option for you. They will help you get a medical director so you can do these treatments so that you can expand your practice. So they've got everything again there to support you and to see you succeed. The next thing is, how fast do you want to expand? Again, it goes back to that question, go big or go small. There is no right and wrong way to do it. So take your time, or if you want to jump head first, definitely do that. There's nothing wrong with it. The third thing to think about is, what services do you want to offer? Do you want to go big and do full body contouring, or do you want to do facial aesthetics and just stick to head and neck? That's okay too. So you can really customize with what you want to do, which is awesome. The next thing is, find your niche and weave it into your office. Do you want to rebrand? For me, it was a great opportunity for me to rebrand to Beyond Smiles. I was Cherokee Dental for 16 years. It was a great opportunity to rebrand to Beyond Smiles Dental Spa because I always wanted to have something that we could call our own. I love the brand Cherokee Dental, but at the same time, it was an opportunity for us to expand and offer even and showcase all the services we have with our new name. So definitely something to think about. The last thing that I have a lot of folks and dentists and folks in general who come up to me and ask, this is a retirement plan. If you are a dentist who is looking for something outside of dentistry to retire with, this is I think one of the best businesses you can get into. Why? Because cosmetics is a cash-based business. You know, it's not insurance. It's not, having to chase after, and we all love it. We chase after, patients who have copays. It's a nice market, but it's a niche market, right? So patients will come seek you. But at the end of the day, when you retire, though, the nice thing is, if you keep your dental license and you keep your medical director license or whatever it may be, you have the opportunity to have a second income. And not only that, is a lot of the treatments, if not most of the treatments and all the treatments that you get from these units that you invest in, that I've invested in Sinclair, they are all delegatable treatments, meaning that you can have and train a staff member or team member to do the treatments. You're not having to be there 100% of the time, which is one of the benefits of having that. So something to think about. Lastly, pearls to take with you if you decide to go into is clinical results versus treatment expectations. They always say overpromise or under promise, over deliver. I always get that wrong. Under promise, over deliver, right? Because you want to make sure that you have your expectations, the patients have their expectations, and what you are going to give them as treatment results and what they can expect. So you can set realistic goals for patients and realistic expectations. So they're not expecting to look 30 years younger, right? You want to give them a reality check and say, okay, these treatments are going to give you a beautiful and refreshed look, right? Maybe 5-10 years younger, but I'll tell you, you will look beautiful and you will look refreshed, and then your skin is going to love it. Create your own portfolio, which is what I did. Definitely exchange, photo consent for, I shouldn't use the word discounted, but maybe promotional services, right? To exchange for photo consent, offer promotional or discounted services to loyal patients who've been with you for a long time. I build my own crowns at my office. So during the break time, I would have my esthetician come in, bring the Pristine, which is the microdermabrasion unit, and do a quick, 5-10 minute microdermabrasion, clear out their pores. And at the end of the treatment, their skin looks great, soft, and the crown's ready to go. So you can do things like that to really pique their interest and get them, enjoying something that's not dental, so very cool. The next thing is, with patients, follow up, do photos. Photos are, again, the most important thing I think you can do outside of following treatment protocol is to get photos, because patients see them and clients see themselves every day. So you got to have photos to show them the before and afters, because they may not notice the difference. But once you see those photos, they will be like, oh my goodness, I do look different. Things did change. Things look great. So that is a big important thing. The last thing is to include your entire office, from the administrative to clinical team members. I will not stress that more than enough, because it is the most important thing, because they are your walking, advertisement, because they are your team members. Take good care of them, invest in them, train them, teach them, let them learn with you, because they are the ones who are going to help you also sell the treatments that patients are interested in. Because sometimes when a hygienist gets their cleaning, a patient gets their cleaning with a hygienist, or gets their, bib and napkin from my assistant, patients tell them something that they won't tell me, and then I get it relayed through my staff and my team members, and then it piques their interest, and I can kind of relay that message and talk to them about treatment. So understand that. So really invest in your treatment, your staff, and your team. So, this was my team. I started out just with 4 of us. We grew to like 7 to 8. We kept growing, as we went through. We quadrupled in size. And this is not my entire staff, because some of them couldn't make this meeting, but this is us doing our grand opening, just this last week, and this is us now. We've quadrupled our entire team, which is our new Beyond Smiles team. So then this is in our brand new, newly opened this past Monday. So very excited. This is my team. I love them to death. And I stand by them with everything that they've done for me, and I keep working with them because I love them, and I've just got the best team out there. The last thing, I would say, I got this, I had a patient push me and say, sometimes you just got to take that leap of faith and really go to where you want to be. And this is where I want to be. I want to be with my family. We pulled in together, we took that leap of faith, and here we are side by side with Empire right now, talking to you guys, and Sinclair. They've been with me from the beginning, and I couldn't have been more thankful for their trust, their help, and all the things that they've given me for my own office to push through and really be at this point in our lives and our office to be where we are now. It's been an incredible journey. And I'd like to finish by saying thank you so much, Empire. If anybody's looking to do medical training with Empire, again, they have such a laundry list of things that you can join and do and train and learn. And aesthetics, from an aesthetics standpoint, Sinclair, again, they're the Toys R Us of cosmetics to me. They've got all the aesthetics you need, everything and everywhere, all at once, which is my presentation. So thank you.
Perfect. Well, thank you. First of all, before we jump into questions, I want to say congratulations on opening that new beautiful building on Monday. That is so exciting and it's
Thank
so
you.
pretty.
Thank you.
All right. So our first question is, hi, are these equipment options items that you have purchased, leased, or are they on subscription? So if you could talk a little bit about the options that Sinclair gives.
So I know when I purchased them, I got it through a loan. So when I first started with the smaller unit, which is the little brother, which is the V10 that had like 4 or 5 different treatment modalities that you can do with, I had gotten it with a loan. So what Sinclair will do is you have it, they'll give you monthly passwords, and so you can keep doing it for like 30 days at a time, and as until that loan's paid off. Once that loan is paid off, then you get a brand new code that gives you unlimited, treatment days. So basically, then you obviously own the machine. So I never leased it because I wanted to own it. So, but I believe I don't. That's something you'd have to talk to Sinclair. But my pathway is I had gotten a loan from my bank and purchased it that way. The V10, which is the baby brother that I purchased, I was able to actually pay that off in about 4 or 5 months. We were able to bring some clientele in, and I went in on Saturdays. I'll be honest with you. Obviously our dental office is open Monday through Thursday. We treated patients and clients on Fridays and Saturdays because that's where they could make it, right? So, and I didn't have an esthetician at the time, and we didn't have anybody that was trained outside of myself, and a couple of our entire staff was trained, but obviously nobody wants to work on Saturdays, right? So that's how we were able to pay it off. We paid it off pretty darn quick. A lot of the other machines, they're all, I'm pretty much all paid off for, except for just one machine that I'm just doing a loan for. And I've only got, I think 12 to 18 months left on that payment. And that's it. Other than that, I've been able to pay everything off, which has been, a good feeling.
Absolutely. All right. So our next question, would these treatments be delegable to a dental associate with a reasonable commission?
Yeah, you definitely can. There's different ways you can go about doing the commission, right? So if you want to delegate it, you can definitely do that per treatment, or you can do a full package treatment, right? So like, for example, a VST, a lot of times on average, there are 6 treatments in a package, right? So you can do one of two things. You can sell the client the entire package, which is what we usually do. We will have them pay everything up front. And what that dentist or whoever you're delegating the treatment options to, if you want to pay them via commission or whatnot, you can give them a percentage of that sold package that they sold, right? But then they do need to do the treatments, right? So they have to be the ones administering the treatments for the next six sessions. The other option you can do is you can collect everything up front from the patient, and then whoever is treating that client that day, you can take that percentage off of that treatment, and you break it down basically into six payments, right? Basically, and you just delegate that for commission based on that day that whoever treats that client. So there's multiple different ways you can go about doing that.
Perfect. And that is all the questions we have. I know we always get asked, do you sell your treatments in packages normally, or do you sell like one-offs here and there?
For like a lot of these treatments, they're time buildup treatments, meaning that you do a treatment one session, you're not going to get the results, right? Because these are natural organic treatments where you're treating the client with radio frequency and heat and energy. So these are collagen building treatments and elastin building treatments, right? So these are treatments that you will see the results over time. So you can't, unfortunately, just do one treatment and expect to see results the next day. These are treatments that over the next 3 months, 6 months, you're going to start to see them slowly evolve over time. And that is the one thing why I brought these machines and these units into my office, is because these are treatments where you're actually growing and building collagen. You're not just doing a filler injection and then 8 months later, they've got to do it again. These are treatments that are staying with the clients. So these are treatments where that collagen is staying, and as long as they're on maintenance and they keep doing what you're having them do, they will stay like that. So that's what's really nice. So you can't really just do one treatment and then expect to see the results that I get, right? So you sell them in packages. Now, when it comes to packages, you can stack packages, right? So let's say, for example, you have a client who wants to do body contouring. You sell a package for body contouring and adipose reduction. Then you also sell and add in a dermafuse hydration treatment, right? Because the more hydration your skin has, the better that treatment will actually absorb the radiofrequency, heat, and energy into the skin and make that treatment even more efficacious and more effective, and the better results you'll get. So that's when you want to stack treatments. That's where I start to stack treatments, is because you can add these treatments on top of each other and get even better and better results. Now, some of those photos you saw, I didn't even know that you could stack treatments. So as we've learned, stacking treatments is super beneficial and even gives you even better results. So which is great. And that's why I have so many different units, is because it allows us to really do the best we can for the clients.
Perfect. We don't have any other questions. Do you have any parting words before we let you go for the evening?
Nope. Just want to say again, thank you, Sinclair. Say hi to my wife, my kids, my parents. They're not even watching, but it's okay. But I wanted to say thank you, Empire Medical Training, as well as Sinclair, for allowing me the opportunity to share, my journey with everybody here. And you've got my phone number and email. Please feel free to email me if you guys have any questions. I love teaching. There's so much to go around. So, it's not one of those things where we're all trying to hide, pearls from everybody and what works and what doesn't. For me, Sinclair has been so gracious to me, and I want to make sure I'm gracious to anyone who needs help out there who's looking to get in the space.
Awesome. Thank you so much for being with us tonight, and I hope that you have a wonderful weekend.
Thank you. You too, Fallon. Have a good one.
Bye.
Bye now.